Hello, I am Dr. Duru from the Division of General Internal Medicine and Health Services Research at the David Geffen School of Medicine at UCLA. I am happy to share a summary of the manuscript entitled A Systematic Literature Review of Coordinated Care in Cardiovascular-Kidney-Metabolic Conditions. CKM syndrome is a group of interrelated health disorders comprising obesity, metabolic syndrome, type 2 diabetes, hypertension, dyslipidemia, chronic kidney disease, and cardiovascular disease. CKM conditions are associated with increased risk of morbidity and mortality, with greatest mortality risk in patients with multiple CKM conditions. Thus, there is a need to coordinate treatment delivery to improve health outcomes and reduce morbidity and mortality. This systematic literature review assessed coordinated CKM care literature by describing program types, components, outcomes, effectiveness, implementation challenges, and facilitators. We searched Embase and Medline for studies from January 15 to March 2023 and Congress abstracts from January 2021 to March 2023. To be eligible for inclusion, studies included patients with 2 or more CKM conditions, and the coordinated care program addressed all 3 CKM conditions through treatment, monitoring, or risk reduction. 2 reviewers extracted the data and assessed accuracy. Randomized controlled trials were assessed for potential bias in the design, conduct, and reporting of clinical trials using the Cochrane Risk of Bias tool for randomized trials, and observational studies were assessed using the Newcastle-Ottawa scale for cohort studies. 22 interventions reported in 25 publications met eligibility criteria and were included in this SLR. For the RCT publications, 5 described empirical research, 2 were post hoc analyses, 2 were protocols, and 1 was a cost analysis study. Observational studies included 5 prospective and 8 retrospective studies, and 1 study that was both observational and an RCT. Among the included interventions, 7 were conducted in the United States of America, 4 in the United Kingdom, 2 in Australia, 2 in Canada, and 1 each in Germany, Sweden, Italy, Singapore, Thailand, Hong Kong, and Asia. The interventions were classified into 4 different types based on their distinct features. Most interventions included patient visits to multidisciplinary team care clinics. Although all studies included interventions that targeted patients with at least 2 of 3 CKM conditions, the target population varied across interventions. Only 3 studies included patients with all 3 CKM conditions, 3 included patients with any 2 of 3 CKM conditions, and 16 focused on 1 CKM condition but also monitored the other 2. Most coordinated care programs reported clinical effectiveness and benefits. Effective coordinated care programs may positively impact patient satisfaction and continuity of care, resulting in improved patient outcomes while decreasing healthcare costs. Some studies reported program-related challenges. Gaining consensus among interested parties for program protocols and care management was a challenge, which hindered effective program implementation. In one study, the authors were limited to patient self-reports for monitoring, medication profile, and side effects, without the ability to confirm the accuracy or completeness of these records. Some patients and primary care practitioners experienced problems with information technology integration for virtual programs, either due to system complexity or lack of access to equipment. Moreover, some patients had difficulty attending healthcare clinics for physical examinations or in-person sessions. The main reported challenge of patient engagement or education interventions was non-attendance for return visits, particularly when multiple training sessions were required. This SLR shows that the integration of pharmacists, nurses, educators, cardiologists, endocrinologists, and nephrologists are crucial for the coordinated care team. There are a diverse set of coordinated care for patients with CKM conditions, and coordinated care improves health-related outcomes and reduces healthcare costs. Telehealth options and multidisciplinary team consultations improved access to CKM care, which may be particularly useful in limited access or remote areas. Future research is needed to develop coordinated care programs with standard reporting to assess the effectiveness of programs with contemporaneous controls and to identify components of programs that are most beneficial along with implementation methods. Thank you for watching.